Bladder cancer is a type of cancer that starts in the bladder. But to really get what's going on, we need to understand a bit about the bladder itself. Your bladder is like a balloon made of muscle. It's part of your urinary system, and its job is to store urine until you're ready to let it go. The inside of the bladder is lined with cells called urothelial cells, also known as transitional cells. These cells are pretty special because they can stretch when your bladder is full and contract when it's empty. Bladder cancer happens when some of these urothelial cells start to grow out of control. They divide more rapidly than normal cells and don't die when they should. These abnormal cells can form a tumor and, if not treated, can spread to other parts of the body. Bladder cancer is not one of the most common cancers out there, but it's not exactly rare either. Each year, about 80,000 new cases of bladder cancer are diagnosed in the US alone. Interestingly, bladder cancer is about 3 times more common in men than in women. It's also more common in older adults. The average age at diagnosis is 73. But don't think you're off the hook. If you're younger, bladder cancer can occur at any age. Types of bladder cancer. Now, not all bladder cancers are the same. They can be categorized based on how far they've grown into the bladder wall. Number 1. Non-muscle invasive bladder cancer. This is the most common type. This means that the cancer is only in the inner layer of cells lining the bladder. It hasn't grown into the deeper muscle layers of the bladder wall. This type makes up about 75% of all bladder cancers and generally has a pretty good outlook. Number 2. Muscle invasive bladder cancer. As you might guess, this means the cancer has grown into the muscle layers of the bladder wall. This type is more serious and harder to treat, but thankfully, it's less common. Number 3. Small cell carcinoma of the bladder. This is a very aggressive form of the disease. But it's not something most people need to worry about. It only accounts for about 1% of all bladder cancers. Causes of bladder cancer. Like many cancers, there's no single cause. Instead, there are several risk factors that can increase your chances of developing it. The biggest risk factor here is smoking. Smokers are about 3 times more likely to get bladder cancer than non-smokers. This is because the harmful chemicals in tobacco smoke get into your bloodstream, and then they are filtered by your kidneys, and finally, they end up in your urine, where they can damage the cells lining your bladder. But smoking isn't the only risk factor. Exposure to certain chemicals, particularly those used in the dye, leather, textile, paint, and printing industries, can also increase your risk. These chemicals, like aromatic amines, can cause damage to the bladder lining over time. Age is another factor. As we mentioned earlier, bladder cancer is more common in older adults. This is probably because the longer you live, the more time there is for genetic changes to occur in your cells. There's also a genetic component. If you have a close family member, like a parent or sibling, who's had bladder cancer, your risk is slightly higher. Some people inherit genes that make them more susceptible to bladder cancer, but this is relatively rare. Other risk factors include chronic bladder inflammation, like from repeated urinary infections or kidney stones, having certain birth defects of the bladder, and previous cancer treatment with certain chemotherapy drugs or radiation to the pelvis. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Symptoms of bladder cancer. The tricky thing about bladder cancer is that its early symptoms can be easy to overlook or mistake for other conditions. The most common symptom is blood in the urine, also called hematuria. This might make your pee look pink, red, or cola-colored. But here's the thing. Sometimes the amount of blood is so small that you can't see it with the naked eye. It's only detected under a microscope. Other symptoms can include changes in your urination habits. You might feel like you need to pee more often than usual, or you might feel a burning sensation when you pee. Some people experience a sudden, urgent need to go, even when their bladder isn't full. In more advanced cases, you might have trouble urinating or notice lower back pain on one side. It's important to note that these symptoms don't necessarily mean you have bladder cancer. They could be caused by other conditions like urinary tract infections or kidney stones. But if you're experiencing any of these symptoms, especially blood in your urine, it's crucial to get checked out by a doctor. Diagnosis of bladder cancer. The diagnosis process usually starts with a discussion about your symptoms and medical history. Your doctor will probably ask about your smoking history and any exposure to chemicals. The next step is usually a urine test. This can check for blood in the urine and for abnormal cells that might indicate cancer. Sometimes doctors will also do a urine cytology test, where they look at your pee under a microscope to check for cancer cells. If these tests suggest there might be a problem, the next step is usually a cystoscopy. This is where things get a bit more invasive. A cystoscopy involves inserting a thin, flexible tube with a camera on the end through your urethra and into your bladder. It sounds uncomfortable, but your doctor may use a general anesthesia or a numbing gel to keep you from feeling pain. This test is very important as it allows the doctor to look inside your bladder and check for any abnormal growths. If the doctor sees anything suspicious during the cystoscopy, they'll probably do a biopsy. This involves taking a small sample of tissue from the bladder to examine under a microscope. This is really the only way to definitively diagnose bladder cancer. If cancer is found, the next step is usually imaging tests like CT scans or MRIs. These help determine if the cancer has spread beyond the bladder. Once bladder cancer is diagnosed, the next step is to determine its stage and grade. The stage of bladder cancer refers to how far the cancer has spread. It ranges from stage 0, where the cancer is confined to the inner lining of the bladder, to stage 4, where the cancer has spread to distant parts of the body. The grade of bladder cancer refers to how aggressive the cancer cells look under a microscope. Low-grade cancers tend to grow more slowly and are less likely to spread, while high-grade cancers are more aggressive and more likely to spread. Treatment for bladder cancer. The good news is that there are several effective treatments for bladder cancer. The best approach depends on the stage and grade of the cancer, as well as the patient's overall health and preferences. For non-muscle invasive bladder cancer, the most common treatment is something called transurethral resection of bladder tumor. This is a surgical procedure where the doctor removes the tumor through the urethra. It's often followed by intravesical therapy, where medication is put directly into the bladder to kill any remaining cancer cells. For muscle-invasive bladder cancer, treatment is usually more aggressive. The standard approach is radical cystectomy, which involves removing part or all of the bladder. In cases where the entire bladder is removed, a new way to store and pass urine must be created, either through a urostomy, where urine is diverted to an external bag, or by creating a new bladder from a piece of the intestine. In some cases, especially for people who can't have surgery, a combination of radiation therapy and chemotherapy might be used instead. This is called bladder preservation therapy. Radiation therapy uses high-energy beams to kill cancer cells and shrink tumors. It can be used as a primary treatment for bladder cancer or in combination with other treatments. Chemotherapy, on the other hand, uses drugs to kill cancer cells and is often used in advanced stages of bladder cancer or before surgery to shrink tumors and make them easier to remove. For advanced bladder cancer that has spread to other parts of the body, the main treatment is usually chemotherapy. In recent years, immunotherapy has also become an important treatment option. These drugs help your own immune system fight the cancer. The prognosis for bladder cancer varies depending on the stage and grade of the cancer at the time of diagnosis. Early-stage bladder cancer has a relatively high survival rate, especially when detected and treated promptly. However, bladder cancer has a high recurrence rate, which means that ongoing monitoring and follow-up care are essential. Now, we want to hear from you. Do you or someone you know have bladder cancer? What symptoms did you have? Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.